Hello, everyone. This is Dexter Brooks with HealthNet Co. Insurance Agency. Together, we make insurance simple. Today, we're going to circle back on the American Rescue Plan and the marketplace because we wanted to make sure we presented the slide deck so that everyone will have capabilities to read this as well for themselves. But you can also locate it on our website at healthnetco.com. If you go there and go to news, and you should see that this information is listed there under the news. All right, so American Rescue Plan and the marketplace. As you all do know, recently President Biden signed the American Rescue Plan Act of 2021, which is considered as the ARP, into law on March 11th. ARP makes significant improvements in access and affordability of health coverage through the marketplace by increasing eligibility for financial assistance to help pay for market coverage, which is marketplace coverage. Okay. The new law will reduce premiums for most people who currently have a marketplace health plan and expand access to financial assistance for more consumers. Under the new law, many people who purchase their own health insurance directly through the marketplace will be eligible for higher tax credits to reduce their premiums, and that will start April 1st, 2021. Consumers who enrolled in the marketplace coverage through healthcare.gov or the state marketplace will be able to take advantage of these higher savings and lower costs. Premiums after these new savings will decrease on an average by $50 per person per month or by $85 per policy per month. 4 out of 5 enrollees will be able to find a plan for $10 or less per month after premium tax credits, and more than 50% will be able to find a silver plan for $10 or less. Okay. Next slide. Now, individuals and families may be eligible for a temporary increase in premium tax credits for this year, with no one paying more than 8.5% of their household income for the cost of the referral plan, which is considered as the silver plan or a less expensive plan. Or we consider that also as the benchmark plan, which means many consumers will be eligible for higher tax credits amounts to help cover their marketplace health plan and premiums. This new lower cap on the percentage of the family premium household income addresses the subsidy precipitous for those with family income above 400% of the federal poverty level. Instead of not having premium tax credits for individuals and families who make more than 400% of the federal poverty level, the new law will make premium tax credits available to these families and limit the amount of family income a family needs to pay for their premiums by 8.5% based on the cost of the benchmark plan or referral plan. Next slide. Lower cost and expanded access. Individuals and families may be eligible for a temporary increase in premium tax credit for this. Some consumers who make more than 400% of the federal poverty level may not receive tax credits if the cost of the referral plan or the benchmark plan is less than 8.5% of their household income. They need to contribute to the premium. Okay. When a consumer signs up, they can choose a plan that is the same, costs more, costs less than the benchmark plan or referral plan. And the 8.5% limit is used to calculate this increase in premium tax credit amounts. But the cost of the plan a consumer chooses to enroll in may be greater or lower than the benchmark plan or reference plan. Next slide. The law increases premium tax credit for all income branches for coverage years beginning in 2021 and 2022. By 2021 and 2022, the law applies a new premium percentage owed by individuals and families at all household income levels. It should be noted that most people at all household income levels will see lower premiums as a result of receiving more tax credit to reduce plan prices. Many consumers with family income of 100% to 150% of the federal poverty level would have zero premium plans after the tax credits available to choose from when considering their options and selecting a plan. Taxpayers who receive unemployment compensation during any week starting in 2021 may be eligible for premium tax credits to help pay for the 2021 marketplace coverage. Now, here's some frequent asked questions that we did receive. The first question is, when will additional tax credits be available on healthcare.gov? The increased premium tax credit based on the percentage of the contributions to the lowest income, together with the extension of access to the tax credit to consumers with household incomes above 400%, will be available through healthcare.gov from April 1st. So this means that new consumers and current affiliates who submit an application and select a plan starting April 1st will receive the increase in premium tax credit for 2021 marketplace coverage. Additional tax credits for consumers receiving unemployment compensation will be available starting this summer. Now, if you're going through the states may be doing this a little bit different. I know that in Colorado right now, they are actually going through the process of revamping their systems to get this ready to roll out. We have not heard back on when this will begin, but as soon as we do, we will let you know. Next question. If I'm currently enrolled in the marketplace plan, how do I receive additional tax credit or lower premiums? Good question. And the best way to receive lower premiums is current enrollees, including those who are currently enrolled until the 2021 special enrollment period, can update your application and enrollments to obtain new eligibility results starting April 1st. You will need to reselect your current plan for the changes to take effect to reduce your premium for the rest of the year. Okay, next question. Now, this also is included within that first question. While the SEP for 2021 opportunity is available until May 15, current enrollees can decide during this PMI opportunity whether they may want to switch to a new plan for the rest of the year. You should consider how much you have already paid for your deductible when deciding whether a change in the plan makes sense to you or not. So that's very, very important. So remember that. You should consider how much you have already paid for your deductible when deciding whether or not to change your plan. When you change plans, the amount you've already paid to meet your previous plan's deductible can be reset to zero. I will repeat that. When you change plans, the amount you've already paid to meet your previous plan's deductible can be reset to zero, and you'll have to start paying out-of-pocket expenses again to reach your new plan's deductible. Okay? If you have made significant payment to your deductible, you want to check with your insurance company, or you want to contact us, healthnetco.com, 833-441-4139, and we can assist you with that, because you want to make certain that these options are available to maintain credit for you, what you've already paid. Next question, please. If I live in a state that operates its own marketplace, what should I do? Now, that has been the question that we received for several times. So one of the things we want to make sure you're doing is give you the answer to that question. Slide, please. You want to visit the state marketplace website, or you can call the call center. You can also reach out to us, 833-444-4139. That's healthnetco.com, to learn more about when these additional savings will be available through your marketplace. Next question. If I'm currently enrolled through the marketplace, what will happen if I do not return? Great question. Consumers who signed up for the marketplace plan before April 1st have the option to wait until they file their taxes next year in 2022 to receive the additional amount of the premium tax credit. When they file and reconcile their 2021 taxes, however, we recommend that all enrollees enter. Let me repeat that. We recommend all enrollees enter, update your application, and review the plan options during the 2021 special enrollment period through May 15th, because you may be able to choose a plan with a lower out-of-pocket cost for the same price or less than you currently pay. So that is very, very important. So please, it's very important to shop. Next question. If I don't have coverage, when should I apply? And the answer to that is very simple. If you don't have coverage, and what's the slide, please? Thank you. Consumers who need coverage from April 1st should still apply and select a plan by the end of March through special enrollment period, which is the SEP, so that coverage can begin on April 1st. Then to get the additional benefits, you must return after April 1st, submit your application again, and reselect your plan for higher tax credits to apply to your coverage by May 1st. Okay, that's very important. Here's some more FAQs. If I'm already paying a very low premium or no premium, should I take any actions? Let's see there. Yes, consumers who already are paying low or no premiums may find plans with more generous cost sharing and lower out-of-pocket costs and benefits from changing plans. So that's important. Consumers who are already paying low or no premiums may find plans with more generous cost sharing and lower out-of-pocket costs and benefit from changing plans. Premiums after tax credits will decrease on an average by $50 per person per month. 4 out of 5 enrollees will be able to find a plan for $10 or less per month with premium tax credits, and over 50% will be able to find a silver plan for $10 or less with tax credits. Next question. If I'm getting unemployment compensation, should I wait to basically, since I introduced myself, so I wait to shop? Actually, that's a good question. You should apply and select a plan by the end of March in order to enroll in coverage starting April 1st. After April 1st, you can come back and update your application and confirm your current plan with the updated tax credit later this year. Next. Will healthcare.gov automatically update premium tax credits on behalf of current enrollees? That has been the major question, because normally that's usually what happens. But since this was something that came out unexpectedly, we want to make sure, and I know that healthcare.gov and the federal government want to make sure everyone's able to save money now without having to go into the process of basically updating software, and that takes a little bit of time. So the answer to that question is, slide please. If a consumer don't take action, they still will receive the additional benefits as part of their premium tax credit when filing their federal tax return next year. As of April 1st, consumers can come to healthnetco.com to update your application in order to receive these increased tax credits this year. However, the marketplace is also exploring whether tax credits can be updated on behalf of consumers during 2021. So as soon as we know an answer on that, we will let you know that that may be something that may be automatically done through the marketplace. Now, here's some great key points that I wanted to touch base on. First is, this will start April 1st. If you're shopping through healthcare.gov to the federal marketplace, this will start on April 1st. If you're going through the state marketplaces, you would need to basically reach out to us or reach out to your local broker to find out when that state marketplace will start this new program and when you have savings. Also, you must update your application. That is so key. You have to update your application. The next key point is there is going to be an increased tax credit to reduce your premiums. That's the whole point of this changes. Also, you may see that savings by $50 per person or $85 per policy. Okay, that's huge. Next, household incomes of 100% to 150% of the federal poverty level will have a premium of $0. Can you believe that? Household incomes of 100% to 150% of the federal poverty level will have a premium of $0. Now, also, taxpayers who receive unemployment may be eligible. That's supposed to start this summer. So if you want to go ahead and enroll now, that's fine. That's no problem, because you can come back in April or May and go ahead and get that extra tax credit. And the next key point is Consumers can choose a plan that is the same, costs more, or costs less. So you will be able to change your plans if that's something you want to do. But you want to make certain that and realize that if you choose to change a plan and that plan's deductible reset, you will have to start that over again. Okay. So that is also important. But the bottom reality of this is to save you money. So again, I'm Dexter Brooks with HealthNet Co. Together we make insurance simple. This is why we provide these educational seminars, these educational webinars for all consumers so that everyone is always on the same page, because we believe that when Obamacare was basically implemented, it was about education, because without education, you don't understand, you can't save. You can reach us at 833-444-4139. Our website is healthnetco.com. And I want to thank everyone taking a moment to listen to this again. We apologize we did this again because we want to make sure the slide deck was out there as well, and that this get across the globe and everyone is aware of how much that saving is. So it's not just about the $1,400 that you've been receiving in your bank. It's about that monthly premium that you may have a lot less to pay for. All right. Thanks again, everyone. Have a great weekend and be safe. And don't forget, get your COVID shot.